So the topic is fracture of femur. Let me discuss about fracture of femoral head. Okay, it is caused by the posterior hip dislocation, especially in oldies because of osteoporosis. Okay, the treatment of fracture of femoral head is hip replacement. Okay, the presentation of fracture of femoral head is a shortened limb with medial rotation. As you can see in x-ray, here we have a acetabulum, the hollow oval shaped space for head of femur. The head of femur is fractured here. It causes the medial rotation of the femur, okay, and the shortening of the femur bone. Okay, the next one is a fracture of neck. Okay, the fracture of neck of the femur causes injury to medial circumflex artery. The injury to medial circumflex artery result in ischemic necrosis of neck and head of the femur. The presentation is uh, shortened lower limb with the lateral rotation. As you can see in x-ray, here we have a neck of the femur that is fractured, and the whole femur is in a lateral rotation, as you can see in pic. The topic is bumpers fracture. It is also known as fender's fracture. It is a fracture of lateral tibial condyle and fibula caused by car bumpers collision with limb. Okay, so the bumpers fracture, or it is also known as tibial plateau fracture. Okay, the treatment of bumpers fracture is plaster with 3 months rest. No surgical intervention is required. Okay, the nerve is involved in case of bumper fracture is common peroneal nerve, the branch of sciatic nerve. Uh, the presentation of bumpers fracture is paralysis of muscle of anterior compartment and the lateral compartment. As you can see in x-ray, here we have a tibial bone. The lateral condyle of the tibial bone is fractured, and the fibula is also fractured in case of bumpers fracture. Now the topic is Pottsfracture. It is also known as dupuytrenfracture. It is a fracture of lower end of fibula and medial malleolus. The rupture of deltoid ligament is also associated with Pottsfracture. The dupuytrenfracture or the broken ankle. Okay, it is a bimalleolar fracture. The nerve involved in Pottsfracture is a common peroneal nerve branch of sciatic nerve. The presentation of Pottsfracture is paralysis of muscles of anterior compartment and the lateral compartment that results in foot drop. Okay, so the cotton fracture is exactly as the Pottsfracture, but the difference is it is a unimalleolar fracture. As you can see in figure, here we have a Pottsfracture. It is known as Pottsfracture because of its configuration. You can see it. You can see it has some kind of pot like configuration, so it is known as Pottsfracture. The lower limb of fibula is fractured, and the malleoli is also fractured in a Pottsfracture. The topic is marchfracture. It is also known as stressfracture. Fracture of one of the metatarsals. Okay, in the marchfracture there will be a fracture of one of the metatarsals result from prolonged walking. It is also known as fatigue fracture. Okay, the nerve involved in marchfracture is posterior tibial nerve. Okay, the treatment of marchfracture is NSAIDs, non-steroidal anti-inflammatory drugs, and there will be a some kind of surgical fixation in case of, and also crutches will be used in marchfracture. The most common example, or we can say the classic example of marchfracture is ballet dancers. Because of unbalancing movement of the dancers, it can cause a marchfracture, and also in hikers because of prolonged walking. As you can see in pic, we have a march fracture or the stress fracture of second metatarsal. It can be on other metatarsals, but most common the second one is fractured in case of march fracture.